So the first thing was that the term acute on chronic liver failure is essentially cirrhosis and multi-organ failure. The second thing I would mention is that acute kidney injury and cirrhosis is more than just hepatorenal syndrome. The differential is broad, but specifically for hepatorenal syndrome type acute kidney injury, the use of vasoconstricting therapies, if you respond to them, is associated with improved outcomes. And finally, as we discussed in details, it is very challenging to come up with futility rules with regards to transplant and ACLF, partly because a lot of the data is biased appropriately because we as clinicians make decisions, human decisions, to take people off the transplant list. And probably the best secondary endpoint in terms of making a decision if a patient is truly too sick to transplant is probably looking at waitlist mortality as a secondary endpoint.